In the world of healthcare, it can be extremely challenging and frustrating to try and get answers to all of your medical questions and concerns. But Dr. Ken Redcross says there is a way to create a lasting, caring relationship with your doctor. I recently spoke with him to find out just how. Now, it's a great idea, but I got to be honest, it can sound a little unrealistic for most of us.
Sure.
How does that relationship begin, and why is it so beneficial to have this type of bond with your doctor?
You know, guys, so this bond is important because there's 4 things that I want to make sure everyone out there feels they have with their doctor. That's trust, respect, empathy, and communication. And I hear what you're saying. It seems like it's unreal, this utopia, but why is it important? Because it helps to improve your healthcare outcomes.
Right.
When you have those 4 things together, very important to make sure that you're both aligned.
Okay, I'm hearing you, but I'm also living in reality here. Appointment times can seem pretty short. I mean, you know, they're kind of getting you in and out. So how do you develop that relationship? How can you get more time with your doctor to discuss those issues, those very important issues?
You know what, guys, it doesn't just feel like the time is short. It is.
Right.
On average, it's about 7.5 minutes. Ridiculous, but true.
Yeah.
So that's why it's important that when you go to your doctor's appointment, make sure that it's an active appointment, meaning one of the first things I talk about, make a list before you go in there so that you're kind of armed and ready to go. So in other words, I want you to strategize. The second thing I talk about, Christine, is I want you to go in there and repeat the information when you're in there. Why? Because they do studies that show that when patients leave, they only remember about 20% of what the doctor said. And guess what, Christine? Half of that is wrong. So you want to make sure that you're repeating that information. And last but not least, you want to make sure you ask questions. You remember when we were all in elementary school, the teacher would always say, there's no such thing as a stupid question. And that's true, especially when you're in there with your doctor, because once again, that helps with retention and make sure that your appointment is an active one, not just a passive one.
Now, we have to talk about the COVID vaccine. So many of us, it's on top of mind. A lot of us are hearing that we absolutely have to get this vaccine. It's a lot of pressure being applied from different sources if we, of course, haven't gotten it. So how do you navigate that discussion about the pros and the cons of the vaccine for yourself personally without really kind of having that confrontation style discussion with your doctor?
You know, I appreciate you asking that because it's tough. It's tough depending on age group, depending on where you are in the United States and that sort of thing. But this is something that, once again, that bond is important because I want you to go into your doctor's office and say, look, I understand the vaccine, I understand the importance, but why is it good for me? I need to know my situation because that's where I find a lot of the handoff gets tough when you're just barking these orders, but you have to kind of know, why is it important for them? Why is it necessary? And so those are the things that are important to understand the vaccine and have that discussion with your doctor so you can understand it just like he or she does.
All right, something that I have always done in my adult life, gosh, even as a kid, is take some supplements. I know a lot of doctors, some of them really don't buy into the efficacy of supplements. So how do we have that discussion, you know, making sure that we are doing things that are right for us?
Now, the supplement discussion, guys, is a huge one this year. You know, that vitamin D story, it's funny because now we've already recognized that vitamin D should be an important part of our lives when we thought about bone health. But Christine, now we're talking about immune health, making sure you know your vitamin D levels, making sure that you know those levels should be between 40 and 60. Having that discussion with your doctor is incredibly important. There's been a lot of good data that's already been out about the importance of vitamin D levels, especially in certain ethnic groups, to make sure that the levels are up to be able to fight that. So if there's one thing you leave today besides a strategy to navigate your doctor's appointment is make sure you recognize how important vitamin D is, and all of us should really be taking it or at least knowing what our levels are.
Amen, doctor. Thank you so much. Great tips and advice. Where can people go to learn more about this information we just talked about today?
You can always reach me at Dr. Ken Redcross at any of the social media handles, and I mean it. I love meeting new people, so reach out, ask questions, say hello, but above all, make sure that you have that respect and the empathy, the communication, and all those things that are necessary for you and your doctor to have a great relationship.
Thank you so much. We always appreciate you.
Oh, thanks for having me on, guys. Stay well, stay blessed, and healthy, everyone.
Love him.